Welcome to the Doctor's Podcast, Episode 12. Dear Migraine, can you stop? Hello everyone, welcome back to the Doctor's Podcast, where we will be providing health tips weekly. The top of my skull feels like it's been pressed down on. It begins to be such intense pain that I feel nauseous. I thought I was having a stroke or some kind of brain failure because my vision went out in my right eye. Sounds horrible? These are the vivid details of migraine experiences, as illustrated in an article published by SELF Self. Quoting one of my colleagues who also suffers from migraine, she often experiences a pulsing sensation on one side of her head whenever migraine happens. It was not fun to say the least. Not everyone will have a typical migraine. There are different types of migraine that involve different symptoms. However, the common symptoms are an intense throbbing headache on one side of the head. The pain gets worse when you move. The pain can be so severe that it prevents you from carrying out any normal activities. Second, nausea and vomiting. Third, increased sensitivity to light and sound. This is why many people with a migraine want to rest in a quiet, dark room. And lastly, intense tiredness. Migraine symptoms usually last between 4 hours to 3 days. Rather than a one-off event, migraine usually takes on several well-defined stages. It is often difficult to predict when a migraine attack is going to happen. Learning these stages may help you to distinguish a migraine from a headache and to predict the pattern of your migraine attack. The first stage is the premonitory prodrome stage. During this stage, people can feel a wide range of physical changes such as tiredness, craving certain types of food, irritability, mood changes, neck stiffness, and yawning. These feelings can last from 1 to 24 hours. While these feelings may be highly similar to what one may experience in the next morning after binge watching a Netflix series last night, what follows for a migraine patient is called aura. Notice the second stage, aura, is not always present in every migraine case. In fact, about 1 in 3 people with migraines have temporary warning symptoms before the actual migraine attack, known as aura. These include visual problems, such as seeing flashing lights, zigzag patterns, or blind spots. Second, numbness or tingling sensation like pins and needles, which usually starts in one hand and moves up to your arm before affecting your face, lips, and tongue. Third, feeling dizzy or off balance. Fourthly, difficulty speaking. And lastly, loss of consciousness, although this is unusual. Aura typically develops over the course of 5 minutes and lasts up to an hour. Some people may experience aura followed by only a mild headache or no headache at all. After the aura, which a migraine patient may or may not experience, it will be the headache or migraine attack phase, as we mentioned just now. Most migraine attacks slowly fade away, but for some it may stop abruptly. Sleep seems to help end an attack earlier. Finally, it is the recovery or post-drome stage. This is the final stage of an attack, which can best be described as a hangover kind of feeling. Interestingly, the symptoms you have experienced in this stage often mirror the symptoms you have experienced during the first stage. Say, if you lost your appetite during the prodrome stage, you might get very hungry at this stage. The treatment may vary depending on the severity of migraine. If you have never tried any migraine treatment before, consider the following suggestions. Try taking over-the-counter paracetamol according to the manufacturer's or pharmacist's instructions. Nowadays, there are many improved formulas of paracetamol products in the market, which usually come with other components such as caffeine that may reduce headache or migraine more effectively than just paracetamol alone. If paracetamol formulations fail to relieve your migraine pain, you may see a GP or pharmacist for other types of medications. Common options for migraine treatment in Malaysia include non-steroidal anti-inflammatory drugs, NSAIDs, ergotamine and caffeine, and triptans. Ergotamine and caffeine is commonly known as Cafegot in Malaysia. In this medication, there are two active ingredients, namely ergotamine tartrate and caffeine. Ergotamine tartrate belongs to the group of ergots. It relieves migraine by narrowing the blood vessels, especially those connected to the brain. The caffeine is added to improve the absorption of ergotamine by our digestive system. Although caffeine itself does relieve headache to some extent. However, ergotamine tartrate is infamous for its side effects. Paradoxically, ergotamine may even worsen the nausea and vomiting symptoms of migraine. Also, long-term use of ergotamine has been found to increase the risk of stroke, heart attack, and ischemic complications, especially among individuals who already have risk of heart disease to begin with. Therefore, if you have uncontrolled high blood pressure, coronary artery disease, currently on any medications which are supposed to prevent future heart attacks, or are pregnant, you should not take ergotamine preparations. If you would like to know more about migraine, please visit our website written in the show notes. You can read more about migraine on our website. Till then, get enough sleep and rest. Practice social distancing and wear your mask when going out. If you have any inquiries related to COVID-19, check out the Doc to Us app where you could get free virtual health advisory service from our professional doctors volunteers. Stay safe and stay healthy. Talk to us on Doc to Us.